I'll answer the most common COVID-19 vaccine questions. So let's get started. How many shots of COVID-19 vaccine will be needed? The two authorized and recommended vaccines in the United States both need 2 shots to be effective. There is one vaccine in phase 3 clinical trials in the United States that uses 1 shot. Who's paying for COVID-19 vaccine? Vaccine doses purchased with U.S. taxpayer dollars will be given to the American people at no cost. However, vaccination providers will be able to charge an administration fee for giving the shot to someone. Vaccine providers can get this fee reimbursed by the patient's public or private insurance company, or for uninsured patients, by the Health Resources and Services Administration's Provider Relief Fund. Are there special considerations on who should get the COVID-19 vaccine first? CDC is making recommendations for who should be offered COVID-19 vaccine first when supplies are limited. To help guide decisions about how to distribute limited initial supplies, the CDC and the Advisory Committee or Immunization Practices have published recommendations for which groups should be vaccinated first. The goal is for everyone to be able to easily get a vaccination as soon as large quantities of vaccine are available. While CDC makes recommendations for who should be offered COVID-19 vaccine first, each state has its own plan for vaccine prioritization, distribution, and allocation. Please contact your state health department for more information on their planning for vaccines. Learn how CDC is making COVID-19 vaccine recommendations, including recommendations if there is a limited supply based on input from the Advisory Committee on Immunization Practices, ACIP. If I have already had COVID-19 and recovered, do I still need to get vaccinated when it's available? Well, COVID-19 vaccination should be offered to you regardless of whether you already had COVID-19 infection or not. You should not be required to have an antibody test before you are vaccinated. However, anyone currently infected with COVID-19 should wait to get vaccinated until after their illness has resolved and after they have met the criteria to discontinue isolation. Additionally, current evidence suggests that reinfection with the virus that causes COVID-19 is uncommon in 90 days after initial infection. Therefore, people with a recent infection may delay vaccination until the end of that 90-day period if desired. Do I need to wear a mask and avoid close contact with others if I have received 2 doses of the vaccine? Well, yes. While experts learn more about the protection that COVID-19 vaccines provide under real-life conditions, it will be important for everyone to continue using all the tools available to us to help stop this pandemic, like covering your mouth and nose with a mask, washing hands often, and staying at least 6 feet away from others. Together, COVID-19 vaccination and following the CDC's recommendations for how to protect yourself and others will offer the best protection from getting and spreading COVID-19. Experts need to understand more about the protection that COVID-19 vaccines provide before deciding to change recommendations on steps everyone should take to slow the spread of the virus that causes COVID-19. When can I stop wearing a mask and avoiding close contact with others after I have been vaccinated? Well, there is not enough information currently available to say if or when CDC will stop recommending that people wear masks and avoid close contact with others to help prevent the spread of the virus that causes COVID-19. Experts need to understand more about the protection that COVID-19 vaccines provide before making that decision.